and appreciation to the chairman of the occasion, Professor Jia, and indeed the president of the state branch of NMA, Dr. Umar Farouk, for the compliments to me. May I also use this medium to correct the secretary of the association by referring to me as doctor. I'm not one, I'm not an academic, I'm neither an academic or a medical doctor. I am simply Hamza Isa. And I sincerely appreciate the elevation, but I'm not there yet. Thank you very much indeed for that. The Royal Father of the Day, Your Eminence, the Sultan of Sokoto and President General, Supreme Council for Islamic Affairs of Nigeria, ably represented by the District Head of Bodinga, Alhaji Muhammad Bello, the Honorable Commissioner of Health, ably represented by Director of Medical Services, Chairman of the occasion, Professor Jia, a special guest of honor, CMD, Usman Danfodio University Teaching Hospital, National NMA President and current Provost College of Health Sciences, Usman Danfodio University, Sokoto, Speaker, professors here present, deans, chief host, past and present CMDs, CMACs, ES, Health Services Management Board, representatives of the Commissioner of Police and DSS, officials and members of the state NMA branch, of the state branch of the NMA, students of some of the training institutions for health personnel here in Sokoto, members of staff, members of the press, doctors here present, distinguished ladies and gentlemen, Assalamu alaikum once again wa rahmatullahi ta'ala wa barakatuhu. On the basis of the invitation sent to me some few days ago, I was made to understand that I was going to present a paper for an hour, but on the strength of the agenda distributed in this forum, it shows 25 minutes. So my paper is was intended to be for 1 hour, but because of the limitation of time, I will try as much as I can to ensure that I conclude within 25 minutes. The paper goes as follows. With humility and respect, I would like to begin by expressing my profound thanks and appreciation to the state officers and the local organizing committees of the state branch of the Nigerian Medical Association for inviting me to be part of the opening ceremony of this year's annual general meeting of the association. I consider this gesture a great honor, the memories of which shall remain indelible in my mind. As the title connotes, the AGM of the association, which was first held in the state in 1984, as mentioned by the state chairman, is organized every year to provide an avenue for the association to take stock of its activities in the preceding year, plan for subsequent years, and plan for subsequent years. Accordingly, while commending the outgoing officials for their commitment and selflessness throughout their tenure, I wish to use this medium to call on the new ESCO to be elected in the next few days to surpass what their predecessors have achieved for the common good of the association. This year's theme for the meeting is brain drain and the Sokoto State healthcare system. I believe the timing and choice of the theme wouldn't have been more appropriate and relevant than now. For better understanding of the issue at stake, however, the presentation will take a look at the phenomenon holistically, albeit briefly, drawing inferences from previous and current antecedents at the national level. Thereafter, the prevailing situation in Sokoto State, which is the main focus, will be discussed. In the process, efforts shall be made to examine factors that influence brain drain and its effects to societal health and well-being before profiling what are considered to be appropriate recommendations for the consideration of government and relevant stakeholders. The term brain drain is often used to describe migration of highly skilled and well-trained professionals from their local base to other places of work. In other words, it means departure of highly skilled professionals, health professionals, or professionals generally, from developing to developed societies for better opportunities. Some of the synonyms being used for the term include brain exodus, talent brain, and human capital flight, among others. It is called brain drain because it results in the shortage of skilled personnel to help in advancing the genuine developmental goals of the environment being deserted. This phenomenon is a serious challenge worldwide, but more worrisome for developing countries such as Nigeria and indeed a developing state like Sokoto, as it puts our healthcare system at serious risk. The exodus is happening in almost all sectors, but more disturbing is in the health sector, which is our main focus here. The term was first used in 1963 when the British Royal Society used it to define scientists and technologists who migrated from the United Kingdom to North America and Canada. In 2007, the World Bank had it that over 44% of Africans who completed their PhDs abroad between 1986 and 1996 didn't return to their home countries. As alluded by the Honorable Minister of Health recently, records show that by April 2024, the number of Nigerian medical doctors in the United Kingdom alone stood at between 15,000 to 16,000, thus becoming the third after India and Pakistan in the export of physicians to that country. There are lots more in other countries such as Saudi Arabia, Canada, Germany, and the rest of the world. In Africa, Nigeria ranks second after Ethiopia and Ghana. In recent times, nearly 6 out of every 10 doctors in Nigeria would want to leave, as mentioned by the chairman. This may not be unconnected with the belief that foreign and locally trained Nigerian doctors are some of the best brains in the world. Although it is image boosting on our side, the drain is indirectly an enigma to our health system and a drain to the economy. Billions of naira spent by government on the training of those personnel are being wasted as a result of the exodus, thereby losing knowledge, expertise, and skills gained over a long period of learning and on-the-job training. In the last few years, Nigeria ranked 187 out of 191 countries in assessing the level of compliance with the universal health coverage. Part of the reasons for our dismal performance in this area is that the implementation of some of the national health policies that sought to, inter alia, improve the healthcare system through reducing maternal and infant mortality rates, eradicate the menace of cholera, malaria, HIV, TB, and other diseases, as well as provide legal framework for the regulation, development, and management of our healthcare system, sadly remains unimpressive. Without being pessimistic, our efforts towards actualizing SDG number 3 and attainment of universal health coverage by 2030 will remain a mirage as long as this is allowed to continue, because by so doing, will be seen putting unbearable strain on the already fragile health care system, thereby stifling healthy growth and development. For us to make any headway, therefore, we must wake up from slumber and work assiduously towards ensuring marked improvement. Certainly, we need to have a cohesive and well-coordinated approach if we really are serious in improving the healthcare system in Nigeria and especially in Sokoto State. In general terms, it is asserted that Nigeria has roughly 55,000 licensed medical doctors. With a population of about 220 million people, it gives a doctor-patient ratio of 4 to 10,000 or 5 beds to 10,000 patients instead of 1 to 600 patients, as recommended by the WHO. In some sections of the country, it is sadly 1 doctor to 30,000 patients, even lower at 1 doctor to 45,000 in some northern states, I'm sorry, including Sokoto. Years ago, patients from neighboring countries came to Nigeria for treatment. Similarly, we played host to doctors from other countries such as Egypt and India and other sister states within the country. Unfortunately, today, the reverse is the case as a result of frightening depletion of our manpower stock in this critical sector. Some of the major cause reasons adduced for the plight could be classified into what is called push and pull factors. The former include unfavorable working conditions, including lack of motivation and good road system, understaffing, resulting in stressful long hours of work for the few hands left, dilapidated and or ill-equipped facilities, thus denying the personnel conducive atmosphere for work, inadequate or obsolete diagnostic facilities or none at all, rising cost of medication, harsh economic conditions, especially in recent times, insecurity as a result of banditry attacks in almost all parts of the country, lack of prospects for career development, etc., etc. Other problems are inadequate funding, unstable economy, over-dependence on foreign aid, limited institutional capacity, political interference or instability. Cumulatively, the overall effects include reduced access to medical and healthcare facilities by clienteles, especially in the rural areas, loss of manpower and skills, wastages on training, serious deficit in personnel for the health institutions, among others. This situation creates huge gaps such that people are increasingly losing confidence in the efficacy of the healthcare system in Nigeria. Although there were attempts in recent past by the National Assembly to stem the tide by way of introducing legislation for a mandatory 5-year service by medical doctors before grant of full license to them, such efforts became a nullity, as they were seen to be not only coercive and discriminatory, but also blatant infringement on the rights of those professionals. Conversely, the zeal for the exodus could be attributed to a number of reasons under the pull factors. These include incentives for better life, such as family welfare, better education and health care for the children, better working conditions, including attractive remunerations, security of lives and property, job security, etc., etc. Consequently, the Nigerian medical doctor is caught between the need for survival or outright extinction. In some instances, the former is chosen. For those who have decided to stay, we say a big thank you for your resilience, for your commitment, for your doggedness, especially in this critical time of our evolution as a nation. In Sokoto State, within the past 1 year or so, more than 60 medical doctors left to other organizations with better and more attractive conditions of service. Thus, the Sokoto experience could be said to be intra states as well as foreign flight, or what still, refusal to return home after completion of studies abroad, as is the case with some of the doctors in Great Britain and Germany. With the current total number of less than 10,000 healthcare workers put together, including medical doctors, for a population of over 6 million, i.e. a ratio of about 1 to 10,000 persons, we really still have a very long way to go. Although 50 or so medical doctors of state origin graduate from both public and private universities locally, the yawning gap still remains a matter of great concern. As the population grows, the need for more staff widens. On the basis of current turnover, it is estimated that we require more than 20 years or 2 decades to be able to meet our minimum requirements. Accordingly, the state government should hasten completion and immediate takeoff of the state medical school and the adjoining teaching hospital to provide for more training opportunities. The Murtala Mohammed Hospital may be used for the takeoff pending the completion of the permanent site. In addition, admission quotas for medicine into Usman Danfodio University should be reviewed upward through the efforts of JAM and the National Universities Commission. So also residency and specialty programs through the introduction of more courses that are in high demand to address areas where deficiencies exist. These days, our health needs are becoming more diverse and complex. As such, government must show unflinching commitment in filling the missing gaps of the much needed manpower and facilities. The creation of a human resource development unit in the Ministry of Health may ensure seamless implementation and monitoring process. A state strategic development plan should be formulated, fully implemented, monitored, reviewed, and fine-tuned as appropriate. This will allow for feasible and realistic short, medium, and long-term human resource development plans, research and innovations, accurate health data collection for more effective administrative purposes. Institutional building that promotes career development should be fully entrenched. Some few years ago, the state ranked third in data collection and transmission. I hope this will be sustained for the betterment of our state. As part of the manpower production and retention efforts in the state, the establishment of Nana Asma'u Girls Medical College, earlier conceived by the immediate past administration, may be revisited. This will encourage enrollment of females into medical programs in universities, create awareness on the value of female medical education, preserve our religious uniqueness, and wipe out the taboo associated with male consultations to female patients, especially in the rural areas, among others. As a means of further attraction, scholarship awards, in the real sense of the word, may be instituted to cover all health-related programs in both public and private institutions, including schools and colleges of nursing, as well as health ensuring retention of these very valuable and indispensable personnel encouraging retention of these very valuable and indispensable personnel requires a multi-sectoral approach involving government, the NMA, international donor agencies, and other relevant stakeholders. The strategies could be summarized as follows. Government. 1, remunerations. Government may look into the possibility of salary review for medical doctors in comparison with their counterparts in the federal service and other states of the federation. An attractive reward system that may include performance-based incentives, bonuses, extra allowances for rural posting, etc., may help a great deal. Staff training and development. Human capacity building is an integral part of strengthening the healthcare system. As such, residency, postgraduate, and other career advancement programs should be fully funded by government to encourage enrollees. The erstwhile higher education scheme for serving officers, i.e. HESO, hitherto domiciled in the Establishment and Pensions Department, should be revived with full funding. Seminars, workshops, conferences, and other professional continuous training programs should be encouraged and fully funded by government. Adequate and timely funding of all health-related programs. Infrastructural facilities should be reasonably enough and of modern technology. The working environment should be made conducive. On this note, we may take a cue from the Abuja Declaration of 2001, to which Nigeria was a signatory, and by implication, all the 36 states of the Federation and the FCT reaffirmed in 2023 of allocating 15% of our annual budgets to health. As it is now, although government is doing its best, real commitment must be seen to be done in tackling underinvestment in the sector to mitigate the current and foreseeable challenges. Through this, we will ensure sound economic returns, attainment of socio-political benefits, improved educational standards, and reduction in mortality rates, among others, which are all byproducts of an efficient healthcare system. Establishment of Health Sector Development Bank or any relevant agency for the grant of soft loans with zero interest to eligible applicants for health training and research, similar to the Bank of Industry, for easy access to funding. As a matter of policy, a health development levy, such as the Education Development Levy, instituted years ago by the state government, may be put in place by the present administration so that a certain percentage is deducted from all contracts awarded by the state government to be dedicated in a separate account in the Ministry of Finance, specifically designated as additional funding source for health. In addition, the introduction of special taxes to be paid by owners of all business premises statewide may be explored as additional funding source to reduce the financial burden on government. Medical doctors wishing to pursue further training may explore usurping the opportunity provided by the Nigerian Education Loan Fund, set up recently by the federal government with a take-off grant of nearly 2.5 billion naira. So far, well over 20,000 applicants have enrolled. Other federal forms of training support include the federal scholarships under the Bureau for External Aid, PTDF, and others by some foreign countries. As government alone cannot handle requirements for efficiency for the health sector, external support and PPPI, that is Public-Private Partnership Initiative, may be sought and explored through support by philanthropists such as Dangote, Bua Cement, telecom companies, and some foundations. We have already seen this in the Specialist Hospital Sokoto through the MTN Dialysis Center, Sultan Abdurrahman School of Health Technology, Gwadabawa, and Usman Danfodio University Teaching Hospital, where there are currently building construction projects going on by BUA. Engagement of health professionals in diaspora, as in the case of Advanced Medical Diagnostic Center Farfaru, is also another palatable option. Establishment of regional centers for the treatment of specific ailments to reduce medical tourism, improve local services, reduce the stress on foreign exchange earnings, attract brain gain, as well as possible collaboration with fellow health personnel in diaspora. This may be part of the proposed expansion projects by the federal government of 12 selected tertiary institutions across the country. More collaboration with development partners and international donor agencies. However, to attract funding from these agencies, government must ensure that payment of appropriate counterpart funds is effected at the right time, and any funds so disbursed should be judiciously utilized for the purpose intended, for the sake of getting more as well as justifying the confidence reposed in us. Of recent, the federal government introduced the Nigeria Health Sector Renewal Investment Initiative. This is an initiative largely funded by Global Fund, which has already pledged 1 billion naira support in the next 3 years, the highest for a single country, out of a budget of 15 billion naira, excluding another $1 billion, not naira, and then excluding another nearly $1 billion from other international donors. The primary objective of the program is to improve our healthcare system in the country in its entirety. The fund is further committed to providing 60 oxygen plants across the country, as well as providing support for improving training for health professionals in selecting teaching hospitals. To my mind, this is an opportunity worth usurping by the government as complementary to its efforts. No doubt, they have been worthy partners in progress who deserve commendation. Finally, very special thanks to the Honorable Commissioner of Health for her exceptional support and encouragement for convening programs such as this, and indeed her keen interest in health development efforts in Sokoto State. Further appreciation to the Primary Health Care Development Agency and other parastatals of the Ministry of Health for their dedication and commitment. It is fervently hoped that our policies shall be sustained. It is also hoped that by August 2025, God willing, when we celebrate another AGM, we will be counting on the successes achieved as a result of this meeting. May Allah, to the NMA and other guests, we thank you all for making the event a huge success. May Allah subhanahu wa ta'ala continue to guide and bless our modest efforts. Amen. Thank you all for